Can you hear me?
Yes, I can.
Oh, okay, yay. All right.
Oh, so easy, right?
So, was it?
It was easy. All right, so let me get myself situated because I've got all kinds of situations here. Okay, so what are we talking about today?
Okay, so we're going to talk about cardiometabolic risk assessments.
Yes.
Pretty exciting. I know everybody's very excited about this.
And next month is Heart Health Month. So,
Oh, this is perfect. I didn't even realize that.
yeah.
But I should, because, the heart ball is next month. So,
hmm
which makes sense
So,
because of love. Love. So.
good to start. So,
So, we are going to start doing um, cardiometabolic risk assessments next month, which I'm really excited
which is
about,
like a
which
week.
is like in a week. Yeah. So we're going to start doing it in a week. So we're getting all of that together right now. And I think it's going to be really helpful for, our patient population. And I think it's going to be really helpful to, help patients, decide to make some good changes in their lives and their, diets, exercise, that kind of stuff. Um,
Yeah.
Hold on, let me fix this.
The whole prevention, right?
Right. So let me tell you a little bit about cardiometabolic risk assessments. So why do we even care about this? This is kind of like, I think the big dollar question here. So, cardiometabolic risk is basically, trying to figure out what the likelihood of you developing cardiovascular disease, like heart disease, type 2 diabetes, or any other metabolic condition. And what we're going to do is look at different health factors or labs and then look at your lifestyle factors and kind of calculate them together to see how much of a risk you have, to develop something like heart disease, high blood pressure, high cholesterol, and type 2 diabetes, or, pre-diabetes, insulin resistance, so things are really, really, really important to identify really early so that we can intervene and make, meaningful changes to people's lives and people's health so that long term they don't develop these things.
Right. So, who's the good person? Like, who would need this?
That's a really good question. So, adult people, someone who's depending on kind of underlying risk factors. So, let's say all comers who are generally healthy, people who have not really had any health problems previously, I would say after the age of 40 and before the age of 70 would be a good group of people to have a cardiometabolic risk assessment done. Now, if you're a younger person who does have other things like, you're insulin resistant, or you have obesity, or you have some mild hypercholesterolemia or like high cholesterol, you would also be a good person to have a more in-depth risk assessment done at this point.
What about family history? Mom had heart.
Early history would be a good, that would be a good choice as well. So when I say early family history, I mean mom had a heart attack or mom had a stroke, diabetes diagnosed before, about 50, and dad before the age of 40. Or even if mom or dad, were quite sick in their 40s and 50s, starting off, you're still at an increased risk given that family history. So you would be a good person to make sure.
Yeah. Yeah. Okay. All right. So then what is involved in these evaluations? Like how do people get started with it with us?
So I think, one thing that should be said is like, how is this any different from when I go to my regular doctor? Like I go to my regular doctor, they check my cholesterol, whatever, they check my fasting blood sugar, and how does this differ in any way? So, given that, we have been regular doctors and, we do a little bit different kind of medicine now, I can speak to what the difference is in terms of regular, yearly assessment versus cardiometabolic assessment. So with the cardiometabolic, it's a more in-depth look at factors. So not only are we looking at cholesterol, fasting blood sugar, but we are actually looking at some more in-depth lab assessments of cholesterol and blood sugar, and also risk of diabetes. We also are looking at your inflammatory markers that have been shown in research studies to be particularly associated with the development of cardiovascular disease and diabetes. The other things that we're taking into account that may not be quite as, kind of integrated the assessment in a normal exam are things like blood pressure, the waist circumference, weight, as well as a body composition analysis. The other thing we're going to look at, during the assessment are your lifestyle, like do a lifestyle assessment as well, meaning looking at diet, physical activity, smoking, your stress levels, sleep level, like sleep, not sleep levels, your how good your sleep is, because all of those things have been shown to change or affect, your cardiovascular and diabetes.
So what, these lab tests, is this the same thing as like the cholesterol panel you would get normally, like annual labs?
Yeah. Well, so it involves the cholesterol panel. That is the base of what we do. However, it does involve other, kind of more specific labs within the cholesterol and within the diabetes assessment. And a lot of these tests are often used in calculators that have been proven in studies to show increase or decrease risk of these different health problems. And so we use these different health markers to, like, within these calculators to assess your risk.
What about, are these tests that like a regular, primary care doctor, provider would be ordering?
No, not really. So the basic lipid panel is generally what a regular doctor would order. Beyond that, maybe a fasting blood sugar. Those two things are recommended by the basic guidelines. With in terms of getting your physical exam done. However, your regular assessment isn't going to check for inflammatory markers. It isn't going to check for the more specific things within the cholesterol that are particularly sensitive and showing increased risk.
Okay. And so then what do patients need to do like for this evaluation?
Good question. So it's not fancy. So basically, you have to fast for 8 to 12 hours before you have your labs done. So you'll have your labs done at one of the local lab cores, and then we will receive the results. The other thing that you would do is about 15-minute online information gathering when you sign up. So it kind of takes like your history, your family history, some basic stuff like that, and puts it into the computer. And then you would also come to our office for a short visit where we would check your waist circumference, your BMI, weight, and your blood pressure. After that's done, you'd go and get your body comp done, body composition analysis done. And then we would meet after that for about an hour to go through all of the results. And then we would give you both your risk assessment and then some recommendations on what to do going forward. Now, if you're at particularly high risk, or you're particularly concerned about your cardiovascular risk, we can also add something called a calcium scoring, which is a CT scan done looking at the coronary artery specifically. And it is used with a risk calculator called the ASC score in order to assess your how at risk of having a heart attack long term you are. And so this calcium scoring is used a lot in Europe in order to risk stratify people for cholesterol medicine use.
Okay. All right, good. Now, what about cost?
That's a good question. So, the cost of having the entire analysis done, including the labs and the body comp, is $600. So that includes the follow-up visit where we go through everything and give recommendations. It includes the labs and the body composition analysis. So
And does insurance pay?
it's a really good question. It really depends on what kind of insurance you have. With regards to the labs themselves, they're included in the cost, so that we're paying. So I, I think you can probably use an HSA to, pay for the cost of this, the entire thing. But I don't think it would be feasible for you to get reimbursed, from the insurance company. But I don't know. That would be something you'd have to ask your insurance company.
Or HR, yeah.
Yeah, exactly.
But this is something that, again, regular and no knocking, regular primary care offices. We've been there. We not that you don't want to do it, it's just there is no time.
No time to do, something, this all encompassing, just because of the fact that, this takes multiple steps. This is, it's a really in-depth look. And also, when you get your recommendations, we're going to be talking about, diet, exercise, what we think, what we would recommend, going forward with your own doctor, you know, in terms of, healthcare follow up, things like that. So, and you're right. We've been there. We have been, in, the regular primary care realm for a long time. And, I think a lot of us, in that, realm would love to be able to do this. But, what's nice about this is that we're able to do this for your primary care doctor so that they can kind of take it and run, so that they, kind of just shortens up. They're like, okay, now we have all this information. Here are the recommendations. Now I can help you to kind of get where you need to get to, with from this risk assessment.
Yeah. I think that there are a lot of people out there who, maybe they were told before that they need to be on a cholesterol medicine, and for one reason or another, they don't want to be on it, and they really should be,
Yeah.
So, and you don't have time, like your doctor or your provider doesn't have time to really kind of go through it with you, explaining sometimes why, and
Right.
people know and they understand, then they can take those steps. Maybe sometimes this kind of evaluation is just like that little extra nudge to get people to start doing more, moving more, or, eating more vegetables.
Yeah, basic stuff, I think that, in my experience with, lots of patients in different settings, I think that people don't want to be told what to do for no reason. And when you give them, substantial evidence that there are some problems that you can fix, I think they'll be very, very motivated to do that. And, I think that these kinds of assessments, provide that kind of information that I think is really compelling to a patient, because they can no longer be like, well, it's just my cholesterol, whatever, and because a lot of people will tell me, all the time, like, oh, well, I've always had high cholesterol and my mom had really high cholesterol and she lived to 90, and I'm like, well, yeah, that's true. However, you're not exactly like your mom. You have half of your dad's genes, you have your family's genes. You might not even have your mom's exact cardiovascular risk genes, so, and what I think previously we have relied so heavily on family history that we have given people a very false sense of security, and I have seen over and over again patients telling me that my mother lived to be 95, my father lived to be 85, and then they have a heart attack at 60, and they're shocked, and I'm shocked, but that has really, I think, proven to me that, there's a lot more going into your risk than your family history. And probably, given the newer data looking at genetics, in risk assessment, we're seeing that that is a particularly small risk, when it comes to the overwhelming, risk that you get from the food you eat, from the amount of exercise, from smoking, from stress, from all of these other environmental things.
So for our current direct primary care patients, this cardiometabolic risk evaluation is really like we've done these for a lot of our patients already. We just haven't, kind of said, this is what we're
Yeah.
doing. We are doing like risk evaluation on you. So, don't feel like you're being left behind, because I feel like I've done this with all of my patients.
So I think that this is a little bit more in depth in terms of, the labs. We have done a lot of these labs with people. We haven't done all of them together. So, I think our current patients, our DPC patients, if they're interested in doing the whole shebang here, we are really excited to do that with those patients. That cost, they will have to pay for the lab costs though. And in that situation, I think their insurance will pay for those labs. We can look into that, I believe. Is that right, Anne? The precision labs will allow them to do that, or no?
Question mark. I think
So I'm not,
I'm not have to check
but
on it.
that's definitely something, that we can look into for our, for our private patients or for our DPC patients. But if, the DPC patients are like, no, I absolutely, like, my insurance is not going to pay for this, or pay for a lot of this, this lab panel, then, we would be happy to do the entire risk assessment, obviously just having the patients pay out of pocket for the labs and the special pricing for the cardio or for the body comp, which I think would be really, really helpful. The body comp specifically is very helpful in any of our patients who are looking to make changes and they're not sure if the weight that they're losing is, the good weight or not, in terms of, visceral fat, things like that. In any of our patients that we're currently doing, a lot of weight interventions, we're currently doing Manjaro, we're currently doing Ozempic with, it would be nice to see over time what kind of muscle loss they're having as well. So that's something, that we are offering to our private patients starting in February as well.
So the body scans will be done there. It's called a STYKU, STYKU body scan. And we have partnered with Muscle RX in downtown Hickory. And so they've given us a great rate for any of our patients, like personal DPC patients or any of our patients that are going to do the cardiometabolic evaluations. The first scan is included with the evaluation, but then beyond that, they have a package where you can go quarterly, you get 3 more scans, and I think I'll have to check on the price. I think it was 169,
Yeah,
which is a break.
really, yeah.
Yeah.
It's a pretty neat scan, and it tells you a lot about visceral fat and other fat, skeletal muscle, all, bone, all the things that you really want to know, when you're kind of evaluating kind of where you're at in terms of, weight loss and where you're at in terms of, just like general strength.
Mhm. Yeah.
This would probably be good for our older patients who are a little concerned that, am I dealing with a little bit of sarcopenia, for instance? Like, am I losing a lot of muscle? What do I need to do to intervene? Are my interventions helping?
Yeah.
Those things.
Yeah, I did the scan and it was really cool because it told me, like one side's a little more muscle on one side than the other, and it's just fascinating.
Yeah. One of my patients told me that she did one similar to the Staiku and was found out that her left leg was stronger than, or was weaker than her right. And then, like, she went through with her physical therapist, like, why that was. And her physical therapist was like, oh yeah, you do have like a hip discrepancy in terms of strength. So we need to work on that. So those are, these things can, give you some kind of interesting information that in the grand scheme of things, may be helpful. It's not like life or death, obviously, but it's, stuff that I think is helpful in just everyday, you know, improvement of your body health.
Yeah. So this is, the cardiometabolic evaluations are, um, again, the goal is prevention.
Yeah,
People with
exactly.
diabetes or you have known heart disease, not the best visit type for you because the idea is prevention. And that's really, when we started this practice, we wanted to focus on that kind of prevention and lifestyle medicine.
Yeah,
Um, lifestyle medicine concepts. And again, that's just something that you need time for.
exactly.
And we have that time now.
Yeah. And with regards to, our diabetic, patients, out there. I think later in the year, we're going to kind of dive a little bit deeper into, off, some kind of lifestyle medicine help, for our diabetes patients as well. And, look, a little bit more, more of an assessment than you would normally get primary doctor's office and, looking at a little bit more like your beta cell function and things like that, how insulin resistant you are, improvement in over time, with diet and exercise. So that's something kind of on the horizon, something that's not really ready for prime time yet, with regards to what we're doing. But, it is something that, we are kind of preparing for later in the year.
Yeah. Yeah. We're going to take I wouldn't say it's a pivot, it's just a shift. Definitely moving more towards preventive and
Hmm.
um, focus.
Yeah. So, Anne, tell us, how do people sign up for this? Like, let's first of all, like, how do non-patients sign up for one of these?
Non-patients can sign up for this by calling the office and just saying that they want to have the cardiometabolic evaluation done, and we'll get you set up. We don't have any availability for this until February.
Okay. And we're doing this on men and women, because I know a lot of you think that we don't see men. But we do. We see men. We do. Yeah. And so anybody out there who we see who maybe you want to sign your husband up for it, that we would be happy to do that. Now, how do our patients sign up for these?
Call the office and let us know.
Just let us do it, and then we'll get the ball a roll. Yeah.
Yeah. So this
Great.
is, for any of our current patients, if you know, or if anyone who's listening, it's not for you, but maybe, you have a family member, spouse, son, daughter that may benefit, just, have them give us a call and we'd be glad to see work on this with them.
I guess the last thing I would probably want to talk about really quick is like, why are we doing this? Like, why are we qualified to do this? I think that's a good thing to talk about. Just because I think that some people out there would be like, why isn't my cardio doctor doing this? Like, why isn't the my endocrinologist or my cardio doctor or whatever. So why are we able to do this? All right. So I'm an internist. Dr. G is a family practice doctor and geriatrician. So we have advanced training in cardiovascular medicine. We have advanced training in endocrinology, which is the study of diabetes and thyroid disease and things like that. So, beyond medical school, we both were trained in both of these specialties during residency. Since then, we have done more training, in both of these terms of our CME, over the last 20 years. We treat a lot of cardiovascular patients. We treat a lot of hypertension, a lot of diabetics. The majority of my practice over the last 15 years has been diabetes, given that I am an internist, kind of what we do for a living. So we have a particular interest in preventing these diseases. Over the last couple of years, we have been training in lifestyle medicine as well. And lifestyle medicine, essentially prevention of these diseases using lifestyle changes. So, using diet, using exercise, using sleep changes, using stress mitigation. So that is something also that we have been able to, kind of weave into our practice and done advanced training in that as well. So I think that, we're at a good place in our training and our experience to be able to help people really, risk stratify and kind of understand how to make changes in their life.
Yeah. And again, your cardiologist, your endocrinologist, your primary care doctor, your family doc, they want to do this with you. I know they do. I did,
Yeah.
and again, it's also time. It's a function of time, and
And
if they have,
you'll find that they're saying the same things to you. You get done, and we give you the recommendations. You go back to your cardiologist, and they'll be like, "Yes, exactly." Like, excellent. Let's do that. So, but cardiologist has 5 minutes with you.
yeah,
So
parents and other people, like if someone else tells them to do something,
right.
They do them. They don't.
Yeah. No, exactly.
Did you, I don't know if I ever told you. When I was in medical school, I was thinking I would do a preventive medicine residency.
Oh, really?
Yeah, and get my MPH.
Oh, yeah.
Yeah,
Yeah.
to residency, or I got further into like my third and fourth year, and then I was like, no, I like family because it has that in that.
Yeah.
It's not, it's people. It's not research based.
Right. Right. Right.
So I'm excited for doing this.
Oh, my goodness. Well, anything to talk about?
I think that's it. I think that's a good explanation of what we're going to do. So, yeah, if people have questions, just give us a call, or you can message us on Instagram or Facebook or wherever you're seeing this. Yeah. And I'd love to do this for you.
I think it's going to be really fun. I think it's going to be like a really helpful for people. And I'm really excited about it. This is really, I think that a lot of us, who have been practicing for a long time, so very much want to make meaningful changes in people's lives. And I think that's kind of the beginning of being able to do that, for people. So I'm excited. I hope that, I know I have, some of my private patients right now are like, yes, let's do this. Let's do a more in-depth look into my cardiovascular risk. That sounds so good, and so I'm excited to do that with them, and I hope that some other people would like to do it as well. Yay.
Okay, so this has been super easy to do, and then now that we know how to do the tech, we can do
more of these, you think? Wait, what?
We can do more of these.
I think we could do more of these. Yeah, we can. It's like a podcast where we're talking. Yeah. Yeah. We can do that maybe a little bit more often. We can do different topics, things like that. I don't know. If there are any topics that, people would love us to discuss live, like, shoot us an Instagram or a Facebook, message, and we can, kind of see if we can do that for you.
Mm-hmm. Yeah. And we will let you know ahead of time. So it's just not like a random time.
Yeah.
11:22 on a Friday.
This is going to be, is this recorded and then like put on the page? Okay. Is this going to be put on Facebook too?
Yeah.
Okay, brilliant. Okay. All right, great. Sounds good. Okay. All right, give us a call if you want to get busy. All right.
Busy living, right?
Yeah. Busy living. That's what we should get busy living.
I like it. All right.
All right.
All right. Bye.